So, good afternoon, class. So, we are meeting after so many days, is it not? We have already seen the topics which I have already taught you all regarding the sampling technique, as well as which one? Anyone has remembered? Research design. Yes. So today we are going to start another important topic, that is hypothesis. Okay. So hypothesis also is a important aspect of the research. When you do the research, you plan your hypothesis. Is it not that what is going to be the outcome of your study? For example, if you are doing some evaluative study based on intervention, then what you do, you write an hypothesis that the post-test mean score of the knowledge or of the practice is going to be increased as compared to the pre-test mean scores of the knowledge or of the practice. So that means what? This is your outcome you are thinking of. But once you do the research, before this, when you have written this hypothesis, it is called as the null hypothesis. Before conducting the research, when you state any hypothesis in the first chapter of your research, it is called as the null hypothesis. But when you conduct the research and you write the findings based on the plan of data analysis, then you write what? The research hypothesis. So whatever findings you get, if that finding is rejecting your null hypothesis, that means your research hypothesis is being accepted. Research hypothesis is nothing but when you do the plan of data analysis and you interpret the study, you may find that the mean post-test knowledge score, okay, is reduced as compared to the mean pre-test knowledge score. So when I told you the first one, it is totally opposite to that which I am telling you now. So that means what? Your research hypothesis got accepted. After doing the research, you have developed this hypothesis based on your findings that the mean pre-test score knowledge, whatever you have got it, it remains the same, but the mean post-test knowledge score after giving the intervention has reduced. Instead of increasing, it got reduced. That means it may happen your intervention is not up to the mark, which is not very interesting, or which is not been implemented in a proper way, or maybe the interventions has not been done properly validation, and the reliability of the tool has not been checked, because of which maybe your analysis data is coming comparatively negative as of the null hypothesis. Clear to all of you? So hypothesis is something which you are empirically testing and identifying that whether it is getting matched, your research hypothesis is getting matched with the null hypothesis or not. Okay. So with this brief concept, let us start with the definition of this hypothesis. You can see here, hypothesis is a tentative prediction. मतलब you are tentatively predicting something. You are not sure, but you are predicting. ऐसा भी हो सकता है. This may happen like this. So that means you are predicting tentatively for time being. It is not for the long term period, for time being. Or explanation of the relationship between the two variables. What you are predicting? The relationship between the two variables. That is your two phenomena, independent variable and dependent variable. So you are identifying what is the existing relationship is there between the independent and the dependent variable, because of which you have stated a problem statement. And you are now finding whether increase in one variable is directly proportional to the increase of another variable, or it is inversely proportional. Maybe knowledge is increasing, practice is also increasing, or it may happen knowledge is increasing, practice is decreasing. Inversely proportionate. Weak connection between the correlation of the knowledge and practice हो सकता है. You understand? So this is what is called as the tentative prediction you are doing, or you are identifying the existing relationship between the two variables. It implies that there is a systematic relationship between an independent and dependent variable. That is what I told, systematic relationship. Either it is directly proportionate or it is inversely proportionate. Knowledge decrease हो रहा है, practice increase हो रही है, या practice decrease हो रहा है, knowledge increase हो रही है, or knowledge is also increasing, simultaneously practice is also increasing. Knowledge is decreasing, simultaneously practice is also decreasing. You understand? So this relationship which has been existing, you are going to identify by giving some intervention. Yes, we know that independent variable is what? Which is not dependent on anyone. Dependent variable is dependent in the change or manipulation of the independent variable. Yes, like for example, smoking causes lung cancer. Lung cancer is a dependent variable. Smoking is the independent variable. If there is no smoking, there will be no lung cancer. If there is a smoking present, lung cancer will be present. So, lung cancer occurs because of the smoking. So, you have independent variable, that is the smoking. You understand? And lung cancer is the dependent variable. So, independent variable is also termed as what? Cause. And dependent variable is termed as effect. Okay. So, cause and effect relationship we can say, which is telling about the relationship between the independent and the dependent variable. Clear? Now, next we are coming hypothesis. If you go to see some important properties of it, that is be measurable. Hypothesis is always measurable. Measurable at what point? Of 0.05 level of significance. Okay, we find out the p-value. Whatever test you have done, pair t-test, unpair t-test, ANOVA, f-test, you have to see what is the p-value at the level of degree of freedom, so and so regarding f value. Degree of freedom is what? It is nothing but we find it out in different ways. If you are doing some ANOVA test, then your degree of freedom will be n minus 1. N is what? Total number of samples. With that you do the minus 1. That is your degree of freedom. If you are doing for association chi-square, your degree of freedom will be row minus 1 into column minus 1 in the association table, chi-square table. Okay. So, this is what you have to remember. Whatever the t-value is coming at degree of freedom, it is depends on your sample size. If your sample size is 150, your degree of freedom will be 149 because n minus 1. N is a total number of sample 150, you minus it by 1, it comes 149. Okay. So, this is what is your DF. Now, at this DF, what is the value of P? You have to check from the table. P value you have to check from the statistical table and see that it should be lower than the value which you have got in the t-test. If the P value is lower, that means your result is significant. It is having some impact, some effect on the intervention what you have done. Clear? So, that is why it is always measurable. The hypotheses are measurable. You have to frame one hypothesis, null hypothesis before your research study. After that, you have to do the analysis part by taking the data and find out whatever your p-value is coming, whether it is causing acceptance of the null hypothesis or rejection of the null hypothesis. If your null hypothesis get rejected, which hypothesis will be accepted? Research hypothesis. That means the hypothesis which you have developed, which you have found it out by doing the statistical data analysis. Okay, research hypothesis comes. It is also called as another name alternate hypothesis. So, research hypothesis or alternate hypothesis, it is being developed or generated after doing the analysis. Null hypothesis, it will be developed before doing the study. So, usually the researcher always thinks that the null hypothesis should get accepted because that is the positive one. What you are expecting tentatively, what you are predicting tentatively before doing your research study. Second is what? Be testable. That is what? Measurable at 0.05 level of significance and also it should be testable. Be clear and easy to understand. Whatever hypothesis you frame, it should be very clear to understand. That means your objectives, outcome should be framed in the form of hypothesis. You can't write two variables or two domains at a time in one hypothesis. Like knowledge, practice and attitude. You want to check these three things among your samples regarding any study. So, one hypothesis will be exclusively for knowledge, second will be for exclusively for practice and third will be exclusively for the attitude. Clear? You can't write in one hypothesis statement three domains at a time. Have you all framed the hypothesis in your study? Yes. So you might have framed one hypothesis, one domain at a time. That is more important. Okay, like you write, there will be a significant difference in the mean post-test knowledge scores with the mean pre-test knowledge scores. Second will be, there will be a significant difference in the mean post-test practice scores with the mean post-test practice scores. Okay, pre-test practice scores. There will be a significant difference in the mean pre-test attitude score than that of the mean post-test attitude score. Like that, different way you have to frame. Explain what you expect to happen. That is the outcome, tentative outcome. What you are expecting to happen in your research study, that you are framing in the null hypothesis when you do the study. Contain an independent and a dependent variable. Without that, study will not take place, because you are going to find out the existing relationship between these two variables. Okay. Next, cycle of hypothesis. What are the different cycles of hypothesis? You can see here, first, whatever hypothesis you are framing is the null hypothesis. Based on that, you are doing some deduction. Deduction means what? You are moving from simple to specific. That is what is deduction. You have so many concepts, theories at a time with you, but you are filtering those things and identifying which is the actual domain you are going to take up in your study. You understand? That is very important. And while doing the deduction, coming to a specific one, based on that specific one, you are doing the prediction, positive prediction. That is what I told you. Your mean post-test knowledge score, there will be a significant increase in the mean post-test knowledge score than the mean pre-test knowledge score. Why you are telling this? Because you are predicting, after doing the deduction, that whatever intervention I am going to give to the samples, that is be very, very effective, which I can see in the post-test scores. Suppose in the pre-test scores, all the samples have scored maybe poor, but in post-test score, you are seeing samples have scored excellent to very good and good also. So that means what? Your intervention is effective. Yes. So that is important, you have to check here. Now based on prediction, you are going for observation. So observation is nothing but you are preparing the tool, you are doing the validity, reliability of the tool, and you are going to implement it on the samples. That is what you see, test of prediction. When you implement the tool to the samples for the data collection, it is called as the test of the tool for prediction, and followed by which you are going back again through the induction. That means from the specific to general, and you are generalizing your findings based on the null hypothesis what you have framed at the beginning of the study. So you can compare maybe your research hypothesis or your alternate hypothesis is been rejected and your null hypothesis is been accepted. Clear to all of you? Next is hypothesis makes the following contributions in the research study. What are those? First one, it provides clarity, okay, to the research problem and research objectives. Whatever your problem statement is there, based on which you have derived the objectives, and based on objectives you have derived the hypothesis, null hypothesis. So it gives a clarity that exactly what you are going to study in the research. Are you going to evaluate the effectiveness of the intervention, and in which areas, in the knowledge areas, in the practice area, in the attitude area, you are going to find out the effectiveness of the intervention. So this is what gives the clarity. And whenever you are framing the problem statement, 5 important components should be present in your problem statements. What are those? First one is what is the approach of the research you are going to use in your study. Like you write sometimes an exploratory study, and descriptive study, and interventional study, a cross-sectional study. Like that we start the problem statement of the study. So that is very important, which is denoting the design of the study. What is the design of your study? Second important thing is the any intervention you are giving to the samples, that has to be mentioned in your problem statement. Maybe in the form of information booklet, in the form of planned teaching program, or maybe in the form of video assisted training program, whatever it is. That should be specified in your problem statement. Third important thing is what? Sample. Who are your sample? You write no, among the adolescent school going girls, among the geriatrics, among the under 5 children, among the antenatal mothers. So this is what is your sample, okay, which you are going to take in your study. Fourth important thing is what? Your setting of the study. Where you are doing the study, it's very, very important. Whether you are doing in the health clinic, or in the hospital, or in the college, school, primary healthcare center, wherever you are doing the study, that should be defined well. That is what you write, no, in the selected hospital of so and so, in the selected school of so and so. So this is what is the setting you are going to mention. Okay, and last but not the least, the population. Who is your population of the study? So these 5 important components should be present in the problem statement, based on which you have derived the objectives, okay, and based on which you have developed the hypothesis. Okay, that is a null hypothesis. Next is, it describes, predicts, explains the expected outcome. When you frame the hypothesis, from that itself you come to know what exactly the researcher is expecting as an outcome based on the null hypothesis. If I am expecting that my post-test knowledge score, mean post-test knowledge score should be more than the mean pre-test knowledge score, that means I am expecting my intervention, what I am giving, it should be very, very effective. Yes, so I have to prepare my intervention in an innovative way, in a nice way, with lot of ABAs or with lot of explanations, some different thing, so that the samples will be developing that interest to go through that intervention, okay, and you will get a better to good and excellent result. Next is, it indicates the type of research design. As I told you in the problem statement also, what type of research design you are applying in your study, and it directs the research study process. How to carry about the study step by step, systematically, from simple to complex. This process is been defined through the null hypothesis which you have framed. Clear? It defines the population of the research study that is to be investigated or examined. Same thing I told you in the problem statement also, population should be there. Here also population should be there. Okay, so that it will be defining whether the specific population has got the benefit out of your research study through the intervention which you have implemented in the group. Okay. Next is, it facilitates data collection, data analysis and data interpretation, because in the hypothesis you mentioned that the association between the two variables will be what? The correlation between the two variables will be what? So when you use these words, correlation, association, it also directs what kind of test you are going to do. In the correlation, you are going to find out the R value. You want to compare within the group or between the group among the components, knowledge or practice or attitude. What is it within the group and between the group? Then you are going to apply ANOVA test. So here also in the hypothesis, it is giving the direction of your plan of data analysis and interpretation also. Okay. Next is types of hypothesis. Very important thing. What are the different types of hypothesis we come across very often in our research studies? Okay. So in the broader aspect, the hypothesis has been divided under 3 categories: research hypothesis, null hypothesis and the testable hypothesis. So let us see one by one what it is. Now research hypothesis, we have under that associative hypothesis, causal hypothesis, non-directional hypothesis, directional hypothesis, complex hypothesis and simple hypothesis. Okay, from the name itself you might have guessed what will be these hypotheses are. Now null hypothesis, as I told you before doing the study, we are framing the null hypothesis. In that we have simple hypothesis, complex hypothesis, causal hypothesis and associative null hypothesis. Okay. Now, in the testable hypothesis, research hypothesis, okay, come to this simple hypothesis, what we have seen in the null hypothesis. It predicts, okay, what it predicts? Their existence of a relationship between the independent and the dependent variable. Simple hypothesis. There is one dependent variable and there is one independent variable. You are just going to find out what is the existing relationship is been present between these two variables through your data analysis. Okay, like I told you, smoking causes lung cancer. Smoking is an independent variable, lung cancer is a dependent variable. Just you have two variables, one independent, one dependent. Simple, it is called as simple hypothesis. For example, you can see here two hourly positions, okay, changing of a fully bedridden will prevent bed sore. So what are those two variables here? Two hourly changing positions and another one is the bed sore of a bedridden patient. So independent variable is which one here? Two hourly position changing. Because if you do this 2 hourly position changing, then only there will be prevention of bed sore will take place. So that is very important. Bed sore is nothing but your dependent variable over here. Fine. Complex hypothesis means what? When you have dependent and independent variable, but you are doing two or more than two relationships you are finding out. So there is not one or two. There may be two or more than two dependent variable. There will be two or more than two independent variable between which you are going to identify the relationship. So you can see here example, for a fully bedridden patient, 2 hourly position changing, 2 hourly back care and a high protein diet will build up the body resistance. See, so many variables are there. 2 hourly body position changing, high protein diet, 2 hourly back care and also will promote the blood circulation and it will prevent bed sore. Can you identify? There are so many variables are here, not only one or two variable. Now, in the above example, there are three independent variables. Complex hypothesis, I have told you just now that two or more than two independent and two and more than two dependent variables should be there. So you can see here the three independent variables are 2 hourly position changing, okay, 2 hourly back care and high protein diet. So if you give this, these are the independent variables. If you give this, you can see there is a change in the dependent variable and there are three dependent variables. What are those? Promotion of blood circulation will take place if you give a back care every 2 hourly, building up of the body resistance, okay, and prevention of bed sore by changing the position and by taking good high protein diet. So this is the example of the complex hypothesis where we have two or more than two independent variable and two and more than two dependent variable which you are going to identify the existing relationship. Okay. Next is directional hypothesis. What is it? Directional hypothesis predicts the direction. See, from the name itself you come to know. What is the direction? Whether it is inversely proportionate or it is directly proportionate. Directional hypothesis, okay. The relationship between the two variables, again independent and dependent variable. Example, high quality of nursing education will lead to high quality of nursing practice skills. Do you agree with this? If the high quality of nursing education will be there, which is your independent variable, based on which the outcome will be what? There will be a high quality of nursing practice skills. Is it clear to all of you? So this is your dependent variable. And it is called as directional hypothesis. Increase in high quality of nursing education, simultaneously there is an increase in the high quality of nursing skill practice. Directional, okay. So the directional can be either positive or negative, either inversely or directly, okay. Next is non-directional hypothesis. What is it? Again, from the name itself you come to know that this hypothesis will not predict any kind of direction. between the independent and the dependent variable. Okay, but does not specifically say that the direction of the relationship. There may be some direction, but specifically it is not telling whether the direction is going to be positive or negative, whether the direction is going to be directly proportionate or indirectly proportionate. It is non-directional. Now, what will be the result? That as a researcher has to conduct the study and find out that whether it is been positive or negative direction. For example, teacher-student relationship influence students' learning. So, either it can be positively influenced or it may be negatively influenced. Too much of teacher-student relationship may sometimes take the students undue advantages of the teacher. So, it is not directly. Okay, too much of strictness between the student and teacher, that too also may cause some kind of difficulties. So that is also not the right one. So you have to identify by stating this hypothesis and doing the study to see whether it is the relationship between the student and teacher is got a directional or indirectional impact on the student's learning. Clear? Next is causal hypothesis. This means what? In causal hypothesis, it predicts the cause and effect relationship. Cause means independent variable, effect is the dependent variable. Okay. Now, what is the relationship or interaction you are going to see between the independent and dependent variable? This hypothesis predicts the effect of the independent variable on the dependent variable. What is its effect? Positive or negative? Like smoking causes lung cancer. So, smoking is an independent variable, but it has got a negative impact on the dependent variable. Are you understanding? Okay. Nutritional diet improves the health of the patient. So, health of the patient and nutritional diet both are the variables. Nutritional diet is the independent variable. It has got a positive impact on the health of the patient. So, that is what it is going to find out. Now, in this, the independent variable is the experimental or the treatment variable. That is what I told you. Cause, the dependent variable is the outcome, or you can also say effect of the study. Example, early post-operative ambulation, okay, will lead to promote recovery. Early ambulation means what? Making the patient to move out of the bed after the surgery. Yes, we do that. Ambulation. Yes or no? Yes. So, ambulation will help to develop more blood circulation after the surgery. So, it is always been told soon after the surgery, no, but at least 24 hours after it passes, depends on the condition of the patient, depends on the health parameters and type of surgery. We need to slowly make the patient to ambulate out of the bed and start walking. So, if you do that, what will happen? It will cause prompt recovery because good blood circulation will be there. It will prevent so many complications and patient also will recover very fast. Okay. So, this is another example which is telling that the relationship between the independent and the dependent variable, whether it will be positive or negative. Okay. So, early ambulation, independent variable, increase or promote the faster recovery, dependent variable, and relation between these two is a positive relation. Smoking causes lung cancer, smoking is independent variable, cancer is a dependent variable, relationship between both are the negative relationship. This you have to get clear. Next is associative hypothesis. Associative hypothesis means what? From the name itself you come to know that it predicts the association of relationship between independent and dependent variable. Okay. When there is a change in any one of the variables, changes also occur in the other variable. This is what is called as association. If one variable gets changed, automatically their impact on the other variable will be there, which will also get changed. Okay, like the associative relationship can be positive or negative. So it is same like what I have given you an example just few minutes back. Okay. Now, what is null hypothesis? You can see here, a null hypothesis is a form of hypothesis that is deemed true until proven. आप इसको तब तक सच कह सकते हो जब तक आप उसको प्रूव नहीं करते, बिकॉज नल हाइपोथेसिस इज योर assumption, predictive assumption, tentative assumption you have made regarding the outcome of the study based on the topic which you have selected. Clear? Until proven wrong based on the experimental data, that means after doing analysis. So null hypothesis is also called as statistical hypothesis, okay, because this type of hypothesis is used for statistical testing and statistical interpretation. The null hypothesis predicts that there is no relationship between the independent and the dependent variable. That is what always we state. There will be no significant differences, there will be no significant relationship. At the beginning of the study, we write like this because we are not sure what is going to be the impact of the intervention, what is being provided. For example, nasogastric tube feeding does not alter body temperature. Null hypothesis. We don't know whether it alters or don't alter. But when we do the study and we get the result, which is called as the statistical hypothesis, the result based on which we say whether our statistical hypothesis is accepted or rejected. Okay. So till you do the study, it is proven true. But after you do the study, you come to know how far this hypothesis is true or false. Next is simple null hypothesis. For example, bed rest will not reveal severe asthmatic dyspnea. Someone is having severe asthmatic dyspnea and you give them the bed rest, but it will not reveal that asthmatic distress. In the above example, the independent variable, that is bed rest. Yes, because if you give bed rest, then only it will have some effect on the asthmatic effect. Bed rest does not have any causal relationship with the dependent variable, that is severe asthmatic dyspnea. Because when there is a severe asthmatic dyspnea take place, you need to go for the medical treatments, like you have to give them puffs, you have to give them bronchodilators, is it not? You have to give them nebulization, you have to give them oxygen therapy. All these things you have to give. You have to put the patient in the cardiac position. So these are the main important things. Only by giving them bed rest, it will not get revealed, not get cured. So that is why this is one of the example which is telling about the simple null hypothesis. Two variables are there. One is bed rest, another is the asthmatic effect. Complex null hypothesis, example, more than two. Already we have seen two or more than two independent variable, two and more than two dependent variable. So examples are smoking. I have already told you this example many times. Drug abuse, alcoholism, tobacco use have no relation in the occurrence of malaria, mumps or chickenpox. Do they have any association? No. They have association somewhere else, maybe in the lungs, in the heart, in the blood pressure. Okay, in all these aspects they have the association, but not with the communicable disease association. Okay. Causal null hypothesis example is what? Intake of high fluid does not cause tissue edema. If someone takes more fluid, do it cause tissue edema? No. Okay. In the above example, the independent variable, that is high fluid, okay, intake does not have any causal relationship with the dependent variable, that is tissue edema. Tissue edema can only take place when you have done some IV lifeline insertion, and if it slips out from the vein, then you may find that the fluid leakage takes place from the intracellular space to the extracellular space. That is what we call as interstitial space, where the fluid gets accumulated, there is a swelling, there is a pain, and you need to take off the IV lifeline and you have to do puncturing of another vein in another side so that this can get reduced. Meantime, you apply thrombophobe ointment and other some anesthetic gel, all these kind of things to relieve the pain of the patient. Associative null hypothesis, example, increased dose in antibiotics will not reduce the body temperature. Body temperature is what? It is nothing but the inflammatory signs and symptoms. When there is an inflammation takes place, that means when the tissue gives response to any injury, you will see that there is an increase in the temperature, redness, okay, warmth to that part, pain to that part, okay, all these things will be taking place. And inflammation can be controlled based on the antibiotics what you are giving. But here you can see body temperature may increase because of any disease producing microorganisms, okay, and the increased dose of antibiotics will not reduce the body temperature. You may have to apply, apart from this, all the nursing management like cold compress or any kind of tappet sponge based on the temperature. Paracetamol has to be given to reduce the body temperature. So with this we will stop the class here. Next class we will continue with the another part of the hypothesis, that is the testable hypothesis.